my take, and I think that I want to preface this by saying that there are more people than you think that may suffer from some level of depression. Whether or not it warrants medications or not, it's there. And I think, in getting back to the stigma of psychiatry real quick, I think that, again, historically, people will just give, some docs or some providers may, it's not a standard of care, just give medications just because you're depressed. But I think to sit with a seasoned provider, a team that we have here, we have a lot of providers here that can manage mental health and addiction and anything under that psychiatry umbrella. I think it's important to get in front of a provider that can understand the dynamics that promote someone's depression or anxiety or whatever the issue may be. I think as far as tips, I think for the most part, I can feel comfortable saying that I think everybody around today, they either know a family member or a friend that may have suffered from mental illness, either having depression or maybe a completed suicide or a suicide attempt or addiction. It's there. But in talking about depression and just managing that, it's important to recognize that you need to get in front of a mental health provider, someone that you have vetted and actually researched, because I think it's very important who you sit in front of and who you open up to. I think if you look at understanding what depression is, it's not just people crying. It's not just people feeling sad all day. It can manifest as isolation. It can manifest as poor concentration, poor appetite, poor sleep. Someone may not even know, because maybe sometimes people have been living with this for their whole life. I typically look at productivity and how they manage their social life and their family life and their professional life. So I do think that the priority, if you feel that there is some level, and it typically your friends and family may say something. I think that might be a cue, if you're unsure, is to go see a mental health provider. As far as tips managing, that's my first tip. If you don't have access to a mental health provider, I think that the second piece is, if you can manage your mood or your thought depression, if that's a depression, what you think it is, I think engulfing yourself in positive hobbies or surrounding yourself with positive people, those are some avenues to remedy your depression. Now, when I say depression, again, there's depression that may need meds, there may be depression that needs therapy, there may need meds, there may be treatment in which you see a provider where it's just an open session where you're provided insight, and it could be once or twice a visit, and maybe you've found the tools to manage depression. Again, there's no clear-cut points where I can tell you to do this, and this, other than seeing a mental health provider. It's never uniform for everybody. Everyone's individualized, and that's why, again, getting in front of your mental health provider, someone you trust and someone you vetted, to understand the dynamics behind the depression, and trying to determine whether or not it's something that's innate, genetic, or maybe it's an experience. Sometimes trauma can promote depression. So those things, again, it's going to take a trained health provider, and I think from that point, there definitely can be tips and management of those depressive symptoms if they do continue, and that's if you don't continue with that mental health provider.